Good evening, everybody. I'll be speaking on the updates of retinopathy of prematurity. My references are from which one? This one? Coming full screen. My references are from American Academy of Ophthalmology, International Classification of ROP, which was released in 2022 October, and National Neonatology Forum, their guidelines released in 2023. As we all know, coming to the zones, the posterior most part is called the zone 1, and anterior most part is called the zone 3, and the central part is referred as zone 2. Now, International Classification of Retinopathy of Prematurity has added another zone, that is posterior zone 2. Reason for addition of this new zone is that the more posterior the disease is, the more aggressive the disease is. So that's the reason why they have again subclassified zone 2 into two regions, anterior zone 2 and posterior zone 2. Coming to the normal development, by about 16 weeks, central zone 1 is vascularized, zone 2 by 8 months, zone 2 is vascularized, by 9 to 10 months, the whole retina is vascularized. Stages and their updates, the first one remains the same. In stage 1, a clear-cut line develops between the vascular and avascular retina. In stage 2, a ridge-like structure develops. In stage 3, a fibrovascular structure develops from the ridge. And in stage 4, subtotal, retinal detachment, which is subtotal, develops. Here, International Classification of Retinopathy of Prematurity has classified stage 5 into 5A, 5B, and 5C. In 5A, we can see total retinal detachment. In 5B, we can see a closed funnel retinal detachment. And in stage 5C, we can see anterior segment findings like lid edema, conjunctivitis, corneal edema, and then white pupillary reflection. And this is one interesting development in the International Classification of ROP. There, they have completely changed the earlier term called aggressive posterior ROP. Now there is nothing like aggressive posterior ROP, it's just aggressive ROPN. The reason behind aggressive ROP is not just posteriorly, and it is also seen anteriorly. So then now they have completely abolished the term AP-ROP. Coming to the screening criteria of ROP, these are the neonatal forum of India, which were introduced in 2023. All the babies born below 34 weeks of gestation, babies born below with birth weight less than 2000 grams, and babies born between 34 to 36 weeks of gestation with any of the risk factors. Coming to the significant risk factors which are released by National Neonatology Forum, malnutrition, respiratory distress syndrome, and blood transfusion are the highly significant risk factors in India. Anemia of prematurity and pregnancy-induced hypertension are the significant risk factors in Indian population. As we know, the mechanism of ROP in RDS, there is lung atelectasis, there is decreased lung complaints, baby goes into hypoventilation. To substantiate it, we take the baby for external oxygen supply, there is hyperventilation, then cessation of vascularity, and then RDS develops. In blood transfusion is now considered the second most significant factor for ROP. In stored blood, there is an increased iron load. This leads to oxidative stress, and this leads to increased oxygen delivery to the tissues, and this in turn leads to ROP. In malnutrition remains the third significant factor in India. This malnutrition leads to decrease in the levels of insulin-like growth factor, which is necessary for the normal development of retina. Coming to pregnancy-induced hypertensive conditions like preeclampsia, eclampsia, and in HELP syndrome lead to vascular compromise in the developing fetus. Maternal systemic infections lead to decrease in the insulin-like growth factors, which in turn lead to ROP. And the most interesting factor which has been published by International Classification of ROP in 2022 is proteinuria. Embryologically, retina and the kidney share the same embryological development. So, proteinuria is also noted in patients suffering with ROP because of the underformed glomeruli. They lead to proteinuria. These are the few insignificant risk factors. They are very significant. These insignificant risk factors in Asian population are highly significant in the European and American population. They are highly membrane disease, patent ductus arteriosus, hydrocephalus, hypoxic ischemic encephalopathy, intrauterine growth retardation, birth asphyxia, premature rupture of membranes, and pregnancy-induced hypertension. When to screen? First screening should be performed at 4 weeks postnatal age. In neonates less than 28 weeks of gestation or birth weight less than 1200 grams, our birth age is not confirmed conclusively. ROP screening to be preponed to 2 to 3 weeks postnatal age. Treatment, as we all know, it's either through anti-VEGF injections or retinal ablations. Interestingly, in ICROP study which was released by American Academy of Ophthalmology, they have mentioned reactivation of ROP post-delivery. These are the two images which have been reported by American Academy of Ophthalmology, where in the pick 1, baby had taken intravitreal bevacizumab in 32nd week and 36th week. But in 67th week, the baby had again developed the ROP. And this is a second baby where baby had taken a single dose of bevacizumab in the 36th week, but later at the 50 weeks, the baby had again reactivation of ROP. Coming to my take-home message, National Neonatology Forum declared that in premature babies, prevalence of ROP has almost reached 37%. But even today, diagnosis and management of ROP is still a tertiary care decision. So need of the hour is some artificial intelligence based tool, like how we use a sphygmomanometer which, for blood pressure. We need some artificial intelligence based tool or tool which is easily available, simpler, and which can be handled by even a technician to diagnose ROP. In Europe and America, we have WinROP, which has almost all 97% of accuracy, but the systems which are developed in India have the accuracy up to 90% only, so they are not so trustworthy. So this is my conclusion. Thank you.
Thank you, Dr. Pavan, for this excellent updates. It's a very important topic and very niche topic also. Very few people do this ROP screening, and it's important that we understand how things work, and we have to be up to date in terms of the screening protocols.